Thanks. Hi, everyone. This is Michelle Gramolia, the president and CEO here at Woodland Pond. And thank you very much for allowing the interruption of the movie from Suscom. I was planning on doing this at noon, but we needed to wait for some updated information coming out of the health center, which I now have. So as far as that film, we will resume that as soon as I am done here today. So I don't normally do a broadcast on Thursdays, but I wanted to get together with all of you today to provide you an update as to the status of the most recent positives on campus going into the weekend because I'm not going to be here tomorrow. So we have had some interesting developments over the course of the week. So when I did my broadcast first on Monday and then followed on Tuesday, you knew that we had a total of 11 positive cases among residents and staff on campus. And you kind of knew the breakdown because I issued a memo that included a chart, and we went over that on my broadcasts. So we have seen some interesting information come out since the earlier part of the week. I think that all of you know, or maybe don't, but now you will, that when we do testing here on campus, we often do multiple rounds of testing for the same person, or we'll do some verification testing on someone that has a result one way or the other. And oftentimes those results can be inconsistent. And we have seen that since the beginning of COVID. And I think that that is one of the challenges that we face as an operator, but also everyone that's trying to manage this virus faces at one point or another. So several of the folks that tested initially over the weekend or at the beginning part of this week to add into the 11 positives have been retested. And a couple of those actually have tested negative. This is very consistent with what we have seen throughout this entire year. Somebody will test positive and then immediately retest negative, or vice versa. Test negative, be symptomatic, and then immediately test positive. And we've seen that here. So, it raises the question of, how does this virus work? And, how do these tests work? But once we have a positive in hand, the positive stands, as you know. One of the 11 actually was cleared out of her testing. So she had tested positive a few weeks ago and now is cleared. So she comes off of the counts today. And we unfortunately did have 2 more skilled nursing residents test positive today as part of routine testing. Both of those are vaccinated, and both of those actually have tested positive for COVID in the past. So, and many times negative since. So months ago, these 2 skilled nursing residents tested positive for COVID, were treated as real positives, moved to the COVID cohort, isolated, quarantined, et cetera, for the 14 days. Since have tested negative every time we've tested, which has been, multiple times per month for skilled nursing residents. They've been vaccinated and have since the beginning of February. And now with routine testing have tested positive and remain totally asymptomatic. So it's just, all of these tests and this positive testing and the retests and so forth, it's just very hard to predict how this virus is going to present on tests. And in talking with the Residents Council today, I think it maybe hadn't occurred to everyone on the Residents Council, and I'm not sure if all of the residents realize this or not, but one thing I hope everyone kind of is keeping in mind is that it is only facilities like Woodland Pond or communities like Woodland Pond that have a nursing home or an adult care facility as part of their community or business that New York State is requiring testing of staff and residents all the time. No other industry is being required to test for COVID. So of course, when we're doing this much testing and the virus is still prevalent, we're going to continue to have rapid tests, positive results. So we're different in that way. Hospitals may or may not test, but they're not required to. Doctors' offices and practices may or may not test, but they're not required to. So we are the only industry in New York that every employee is getting tested at least once per week. Most of us are getting tested twice per week. We're the only industry where our clientele or residents in the health center specifically are required to be tested. So we know that this virus shows up on tests, whether it be legitimate or not. And we know at Woodland Pond that we always treat those as real results. So that's kind of an update as to the numbers. So what does that all mean? It means that because we have not had any new positives, knock on wood, in independent living at all, or any suspected exposures, as long as this data holds through Monday, we will be resuming the group activities that we have paused on Monday. So all of the calendared activities, all of the planned activities, indoor visits and so forth for independent living will resume on Monday. That would be Monday, the 19th. So that is on track. We will be working on a revised indoor visitation schedule because Angel, the RN, actually got pulled so that she can work in skilled nursing. Since we have 2 different units now, we've got the residents that are positive for COVID and we've got the negative residents. So Angel was needed back in skilled nursing to work one of those units. So we're working right now, Jason and Sarah are going to work on an indoor visiting schedule for visits in independent living resuming on Monday. So they don't quite have that worked out yet, but they should have that by the end of the day tomorrow. I just asked them about it, so they may not even realize that that's in their inboxes, but concierge will have that schedule and be able to let you know when we can offer rapid tests to your guests and so forth. But the long story short is that, and this will be in the Chanticleer tomorrow, the main dining room will reopen, complimentary coffee will reopen, card games, fitness center, pool, group activities and so forth, all will resume as planned on Monday morning. For the health center, we have mixed information, mixed news. So because of where we are with our testing and because of the latest numbers for assisted living and garden view, we will actually be able to resume outdoor visits for assisted living and garden view residents that are not on droplet precautions on Monday as well, as long as nothing changes between now and Monday. So if you are a resident in assisted living or garden view and you are not on droplet precautions, then you will be able to visit with your loved ones from outside of the campus starting on Monday again. And so our reception staff will be ready to take those reservations just anytime now. So that's the game plan for assisted living and garden view. For skilled nursing, because we do now have 5 residents that have tested positive, we are still on total pause for visitation. And actually that 14-day period reset today because we did have 2 additional residents test positive. So we're looking at 2 weeks for skilled nursing residents to be able to resume visitation at this point, and we will reassess that. So kind of a mixed bag of information. Just kind of stepping back and looking at the big picture, I would like to just share with you that this week has been one of a lot of discussion with a lot of people and a lot of groups about vaccination and then other protective mechanisms to ensure that we are doing everything that we can to reduce the risk of these positive results here on campus. It's definitely an interesting thing. We've got a number of positive tests all of a sudden from different means, rapid tests, PCR tests, asymptomatic people for the most part, a mix of vaccinated and unvaccinated people. So it's quite a mixed bag. So we have to really look at, what are our tools in our toolkit to ensure that we are reducing the risk of COVID on campus most significantly. And there really are a number of different things that can be done. The most important thing is that we are all engaging in safe behavior, mask wearing, safe distancing, quarantining when we're not at work, or being very, very careful when we're not here on this campus. So avoidance is the #1 way to keep the virus off this campus. So safe behaviors, which is what we've all been sort of, has been our mantra since a year ago. The vaccine is a second tool. So avoidance is #1. The vaccine is second in terms of, ensuring that if you do contract COVID, you likely will have less significant illness if you do contract the virus. And then, of course, if someone is to become ill, which knock on wood, we're hoping does not happen, mitigation of symptoms. So there really are a number of things that we need to be doing. And so the conversations this week, I've had many individual conversations. All of our leadership team has. I had a very lengthy meeting this morning with the Residents Council. We talked about this very extensively. We are going to be discussing all of this at the board level next Thursday. It's very, very important conversation to ensure that, each of the tools in the toolkit that I just mentioned, so avoidance, protection on the front end, then vaccination, and then treatment, all of those options are available to us, and making sure that we're absolutely maximizing all of those things to ensure that the chances of these positives is reduced. It's a very active conversation. I can tell you that the Residents Council is very, very invested in understanding the needs of the residents and advocating for those needs. I don't want to speak for the Residents Council, but I am certain that if you wanted to share your feelings with the Residents Council, you certainly could and should. I know that many of you have come to me, and I certainly appreciate that. It's very important for all of us, I think, to hear the perspectives of each of you as it relates to this virus. I read to the Residents Council this morning kind of a lengthy excerpt of an email that I'd gotten from a family member of a resident in skilled nursing. And it's a little bit lengthy, and I had a number of things I needed to cover here today, and I know that I interrupted a movie, so I'm not going to recite that for you right now, but I have been asked to share the actual excerpted language with the Residents Council after I read it. But it essentially really demonstrated to me in a very evident manner. It was very well put together. This was from the daughter of a skilled nursing resident that has been on a declining health path for some period of time, but it was the sentiments and the feelings of the daughter, knowing the situation that her mom is in terms of her overall health, and then getting the news that we had to close the community down in part because of these rapid tests, and her feelings related to that, and also her fear and her sadness for her mom. And it was really well put together email. It's very emotional. It was, a really great picture of, how she's actually feeling when she gets that call that, actually her mom did test positive, although she's vaccinated. Just the sadness that she felt when, we have no choice but to close visitation down in the health center. And, just sort of her lamentation of the fact that, gosh, she wishes that this virus wasn't here. I think that she wishes that the vaccine was a sure thing, and that more people, were either eligible for the vaccine or had access to it or chose to have it. It was just a very emotional but well put together email. And I think that it meant a lot to hear that with the Residents Council. I'm going to share that, as I said, with the Residents Council, and I think that they're planning on, sort of furthering this conversation. We talked about a lot of sensitive issues, and I want to invite that conversation to keep going. This is a very challenging topic for all of us. I think that all of us can kind of see and feel, the various sides of the coin on this. So we've got, just a lot of different feelings and opinions. I think that we need to keep the communication going. I think the most important thing that I can ask of you is that you continue to express your feelings and sentiments to me, and also to your loved ones, to your neighbors. We're not out of the woods yet. This virus is clearly around. We are not sure if these positives, including 2 new today, are resultant from a variant. We don't know if it's because, people have COVID fatigue. We don't know if it's because we've reopened the campus. We don't know if it's because of Easter. We don't know. But what we do know is the virus clearly is still here. So we need to support each other. I think we need to recognize that there's fear. I think that we need to do our best to be empathetic to each other and caring, and just keep talking, because that's ultimately what's going to help us continue to navigate this very challenging virus. I don't have anything else to add right now, but you can definitely look in the Chanticleer tomorrow for a description of the things that will be resuming tomorrow. But again, it's in independent living. It's just about everything. So housekeeping, the concierge will reopen in person. All those things will happen on Monday. So fingers crossed that we have, knock on wood, a quiet weekend. I will be sending out an email with an updated memo and chart of where we're at, just in case you missed some of those numbers. I will have that printed and sent around to everyone before I leave today. And then you can look for your Chanticleer tomorrow with some, more administrative type announcements. But please do reach out to me if you need anything. And if I don't hear from you, I will see you on Tuesday on this broadcast at noon. Thank you. And now back to that movie.